Welcome to ScoliTalk.
Hello everyone, thanks for tuning in today. So today we have a special guest. Her name is Anaya. And Anaya is going to share her story and a little bit about her journey with us today. Also joining us is Jovana, which is Anaya's mom, and Dr. Nick here from Scoliosis KC. So we're all just going to have a discussion here about scoliosis treatment options and Anaya's journey. So when were you diagnosed with scoliosis? Like at what age?
More so 12.
Okay.
Yeah.
So through the years after you were diagnosed, how has that kind of changed life for you, and what have you kind of gone through?
Well, actually, I've been very lucky and blessed because I haven't had really any pain, or I could still do my activities the way I normally do. So it was kind of just like, oh, I have it. Okay, let's just try to get it under control.
Yeah.
So yeah.
Did you kind of feel overwhelmed at first? Like, what is that?
Yeah, a little bit. Yeah.
Sure. And so when she was diagnosed, as a parent, like what information were you given about how to proceed or what to do from there?
When we first found out, she was 12, and they immediately said, go see a scoliosis specialist in New Jersey. And we went there, and immediately they said, okay, yeah, she needs a brace, and we were like, okay, I guess we'll get a brace, because we didn't really know anything about it. And we were under an impression that the brace fixes it, let's get the brace and fix it. And so she got, we're military, so we moved to our next place, and then we got her measured for a brace, and she wore that for a good 7 months, and it was awful. It was very painful, and her curve increased so much. I want to say probably by 25 degrees it went from wearing the brace to not. So we were thinking, this obviously doesn't work. And then we began to look into non-surgical treatments, because we knew we didn't want to do surgery, but she was still under that 40 degree, which with being military, seeing military providers, they want you to have surgery. If you hit 40 degrees, it's like surgery. So she wasn't quite there. So we thought, let's try some new things.
Do you feel like, as a parent, when you received the diagnosis, that you were given enough information to proceed? Were you given or presented with all the options? Did you feel comfortable at that point with what the information that you were given? About understanding scoliosis, how that was going to impact her, kind of what that was going to mean down the road. I mean, do you feel like you were given?
No, honestly, until we came here and worked with you guys, is when we honestly knew. And Anaya is 13 now, so here she'll be 14. So this is 2 years, almost 2 years after, and this is us just honestly understanding that scoliosis is a life thing. It's not a cure to scoliosis. So no matter if you get a brace, or you're doing non-surgical treatment, or you have to get surgery, it's not going to fix it. It's masking, scoliosis, because we never do that. So when we found out, it was get the brace and she'll be fixed. I came across CLEAR and just called around to many of the different providers that will work within our price range, and then we came here, and we are just extremely happy, not only with the treatment, but with the professionalism, with the honesty through the staff, and then just we don't have any false hope. We kind of know, like, this is what you're telling us, and it's your honest opinion of it, and you're giving us hope that yes, if she continues these treatments at home, and we continue to monitor her, we can continue to give you the right recommendations on what you should do in the future.
Yeah. So I mean, as a doctor, and you actually have a non-surgical treatment for scoliosis, I mean, how do you feel about her experience upon the diagnosis of Anaya, like the information that she was given or not given?
It's hard. I mean, I think about who I was probably when I was 12 years old, and I'm thinking of then what it's like for you to go through finding out this. Like, I can't imagine it. And so a lot of, I don't know, that is what I try to think about when families like you come in, or even families that are just newly diagnosed, and then I'm the one trying to give them. And it's like the saying goes of like drinking from a fire hose. Like, we'll sit back and do a consultation for at least an hour just trying to go over those, and it's a lot. We're cramming into a short amount of time, but trying to kind of paint that broad picture of helping you understand what it is. And I have the families I talk to, that it's like, it's a lot of info, but I'm like, they have to have it, because I mean, whether they come back and see me or not, they need to know this stuff for wherever they go. I mean, whether they do an exercise-based treatment or a non-surgical treatment, or they do one of the types of surgeries, they need to know all of this to help kind of walk down that road. And so, I feel like I'm there's no perfect way of doing it, but that's what I'm trying to do when we do consultations and try to do that. Because there is so much, like even a lot of the different, not just Facebook, but different forums on the internet for scoliosis. It's often the blind leading the blind, and I see families, so it's what I try to answer questions and try to help them. Because they're like, just this week I can think of like 2 or 3 posts I've seen online of families, we just found out, what do we do? And I'm like, how would I even answer that question? How do you start? But that's ultimately what we're trying to do, is provide that education in a concise, meaningful way that helps them kind of then see the options they have in front of them. Because I mean, I'll hammer this all day long, that the traditional, like most families that come here and that are brand new, either with diagnosis, or most of them have been through the orthopedic route already and are discouraged, right? They've seen them for 5 minutes, said you need a brace, don't explain anything. I mean, basically your guys' experience. And that's where, some of what we talked about in the recent weeks, as well as I think 2 other moms right now, that they're angry because they feel like they've been let down by a system that's supposed to be doing what's in their best interest. And it's most of the time it's really not. But there's still so much of the standard protocol for treating scoliosis that, again, it doesn't really matter if we catch it early. So a lot of the school screenings aren't a priority anymore, because ultimately we're just going to do maybe bracing and surgery anyways. And a lot of the feedback, I hear this from families regularly, but most of the doctors, it doesn't seem like they have a lot of hope that bracing really matters. So they're doing a generic Boston or TLSO brace that's, let's say, I mean, when you look at the research, it's the least effective brace on the market, or that's what most of the kids in America are getting. And so it's like, if they're going to be put into a brace, I mean, it's miserable. You went through that. Nobody wants to. But if you are going to choose to wear it and do treatment with it, then at least make sure it's one that's really, really good. And so that's been frustrating. I know some of the moms that I've worked with in the last year, one of them in particular was the one who, through working with the orthopedic doctor in Kansas City, got them to offer a new style of brace, more like a 3-dimensional brace. And it took a mom advocating for her daughter for them to finally get the training and start offering that brace. And so it's still not the best, but at least it's better than the Boston or what they were doing before. Right. So it's like sadly, I feel like maybe through what we're doing, or just through parents who are really advocating for their kids, they're finding the research and saying, hey, wait a minute, there's more to this than what we're getting. And so I've found that a lot of families that come here after the orthopedic, in 10 minutes, they're signed up and ready to go, because they've just never had this much education or perspective, and they're ready. Recently had a family that just diagnosed, so they haven't been that. They just, through their chiropractor, or the mom, saw when the daughter bent over. And when they came here and I presented for them, it was a whole different perspective, because they didn't really know anything about it. So it's just a different process of them like, okay, what are our options and what do we do? But when most families have been through the orthopedic route and are kind of left wanting, and they're like, there's got to be something better. Right. It's easy to kind of answer that and show them there is something better. Right. I know I'm rambling. One of the other points that I was thinking about was that, in general, most of the standard world for treating scoliosis does not believe that exercise can make a difference to scoliosis. Right. Most orthopedic docs I've heard talk about that, and that's research that's 30, 40 years old. And so just in the spring, we were presented some of the research at the last conference a lot of coming out of Italy through SOSORT, that there is good peer-reviewed medical research that shows that an exercise-based treatment approach can change scoliosis for one, which just that's the baseline, but that actually can change the need for surgery for progressive cases. So that's what I found, is that knowledge doesn't seem to be common amongst the surgeons around here. Mm-hmm. And so they still, nothing like that works, it's just surgery or bad bracing. And so that has to at least be shared with people so they know they have different options. But I feel like that's what we're just doing like every day when we're working with patients, is just trying to help them understand that there is. But it's not easy, as you've discovered now. Like it's a hard journey, but you know, you've got a couple options, and you get to, as a family, you can pick which, you know, works best for you, your values, and you know what you can do.
Right. Yeah. I know your mom has been really, really supportive of you. So do you have some things you'd like to share about how your family has helped support you through your treatment?
Well, first, my mom helped support me. Like, since we're in Missouri, she's been doing some of the warm-up exercises with me.
Yeah, it's fun to watch you guys always do it together. Yeah.
And that's been encouraging. And she's been saying encouraging words, so. And then my brothers helped me put on my weights for the NMR.
Nice.
And then my dad helps pay the whole thing.
Yeah.
But but overall, they've just been helpful, like with encouraging words, and just been like really supportive. So,
yeah. Well, and that's important, because I can imagine if you didn't have somebody in your corner and supporting you, you know, it'd be a little harder. But you're pretty motivated, so. So, how when you were wearing your brace, so how would you compare that type of treatment to what you're doing now, and do you have any opinions from one to the other, anything to share?
I just have a horrible experience with the brace because it was painful at first, because it's like this big bulky plastic thing you have to wear, and then I would like hate wearing it, like because I would have to sometimes put it over my clothes or wear it under, and I just didn't like it. But with treatment, it's like you can, well, with this treatment, you can just do it and then kind of be done for that time, and then just go out with your normal clothes, pretty much live life, and then you go back home and do it more. But the brace was just like, oh yeah, you wear it all the time. So I like the treatment.
I forget. Yeah, they do the same thing and all that. Yeah.
23 hours a day.
Yeah. So I just did not like it. Yeah.
I'm with you. I'm with you there.
It was messing up her style of clothes. She was like, this is a cute outfit. It's going to mess up my outfit.
Yeah.
Right?
Yeah.
Well, yeah. And I think it's just really hard, too. 23 hours a day.
Yeah.
Well, Anaya's brace was designed around the Regal Chanel brace.
Oh, okay.
Because of where we live for our assignments, it, you know, they didn't necessarily have a brace that would be offered, so you can choose a brace that you like.
So you went to your own provider to do that.
We went through. So we were able to choose a brace, you know, and they would look at that brace and they would say, can't make that brace like that, but we could mimic it as much as we can. So her brace was designed around the Regal Chanel brace, so it's still gave discomfort. So
I found that as I've been looking at it, that it still seems like you could have a system set in place, but it really comes down to the skill of that orthotist or provider who's making it or modifying it. So even some of like, and that's this weird thing, because I don't like bracing as a whole, but the research and shows that good bracing really makes a good difference. So for our program, we've added using the Scoli brace along with the CLEAR program for much tougher cases. You guys know we talked about it. But it really comes down to, I think, the skill of the provider making it to make it work. So I mean, we've had some braces already on some other girls that I wasn't very impressed by, but the more we worked at customizing it, one of them we got an additional 15 degrees of reduction. And it's like, that's huge, and that changes the whole course of that being a successful bracing treatment or not. And so a couple of families that I'm working with that are doing bracing through one of the hospitals, I'm not impressed with the level of management. It's just kind of, here it is, wear it, we'll just kind of watch it. when it's like that needs to be modified every 3 months and changed, and because again, if it's working in 3 months, your spine will be different, and so then that brace is no longer then actually that effective, so it needs to be modified again and changed. And so it seems like even in some of the really good systems, if the management isn't the same, then it's not going to be as effective, and so it's just hard, and that's what's difficult. So again, I don't love the reality of bracing, but it's like if we have a progressive case and we want to do everything possible that is supported by good research that it can work, then at least let's do it as good as we can, to make your life better as much as we can. So it's just fitted well, that it's successful, so we can check it and stress x-ray and make sure it's doing what we want. But yeah, it's no fun. I can't imagine. So.
Yeah. Well, I remember when I was 12 years old and the doctor wanted me to wear a brace. Of course, I really wasn't involved in the process. I was just told this is what's going to happen. So, I tried it. I hated it.
Yeah.
Didn't wear it that long. And of course, my mom was like, wear it. And I'm like, no, wear it. No, wear it. No. I threw it in the trash dumpster and then it was gone and we didn't have anything to worry about anymore. So, but I remember when I was 12, you can really tell that I had scoliosis. So I really didn't, when people were like, wear this brace, I didn't really care much about doing that type of treatment. I didn't realize how important it was, even for me down the road, of how scoliosis could impact me down the road. I saw right then, right now, so I didn't realize the importance of it. So you're very motivated with your treatment. Do you have any words to share with other teenagers out there or young girls who maybe they're really not, they don't find it important to do treatment, and why that is important for them going forward, because maybe it's not impacting them right now, but down the road it very well could, and have a very emotional effect. I know it did for me. So if I would have known, when I was 12, if I would have known what I was going to go through later in life, it would have been more important. But do you have any words to share?
So first of all, I think it's good to have a good attitude about it and stay positive, about the whole situation. And really, you gotta I think for some of it, you don't really know what the path is gonna lead you to. So I think you have to trust God a lot with this process. And
well, what should you do though on a daily basis?
Yes, and you should stay consistent with your treatment and exercises, and it's because it's not just a one-time thing.
Right.
So you have to stay consistent and kind of still do it to help your spine. So
scoliosis is hard.
Yeah.
I mean, it's hard, and it takes hard work to make changes. So you got to be consistent. But if you get in that routine, it just becomes a part of your daily thing. And so I mean, there is hope, but you got to be positive, like you said. You got to stay consistent, and know when you're young, really take advantage of that, because that's when your spine is most flexible. So really take advantage of that time and do all that you can. Because when you get older and then your spine is more rigid, it's oh, you're gonna have to work even harder to try to make even little impacts. So do you have any? You kind of just gave some inspirational words already, but do you have maybe a quote or something what keeps you going? What keeps you positive?
So my mom made this saying, kind of, and I really like that. So it's she said, did you ever hear the saying, destined for greatness? So she said, destined for straightness. So that made me really happy.
I like it. You should make a shirt.
Yeah.
Right?
Yeah, that's really cool. I like it.
So that was one thing that really made me feel happy, and it's not all serious. So just to know.
Yeah. And now I understand that you kind of yourself are going to, start blogging or sharing your story, or have you already been?
Yeah, a little bit, yeah.
Okay.
So it's not so much to get views or anything.
Yeah.
It's just to kind of look back and see like what I was doing before, like how we started and then how I'm finishing or still going. So yeah.
Yeah, well, it's always great kind of following that journey and then seeing where you started from and then seeing where you're at and how all those puzzle pieces are coming together. So I like it. And plus, I mean, you can be, with your positive attitude, such an inspiration to so many others with your journey. So I can see you blogging out there and inspired everybody to keep going. All right. Do you have any final words to share, Dr. Nick?
Not really. I know I appreciate seeing you guys, how you interact and how you parent, and just how that makes a huge difference on perspective, on attitude, on what's important for you and your family. Because it's easy that the scoliosis reality can be daunting. I mean, let alone thinking of it, being your age. And this is something that you'll deal with forever in some way. But it's, I don't know, just having it in perspective of I think about it when I see patients like you are going to be wiser and have better character and, all the positive things that come from having a tough situation, right? I mean, your character is amazing, and hard work, your work ethic, all those things, that's amazing. So in a way, I'm saying you're awesome, and I just want you to know that. But that's what I think about. That if there's one really good thing that can come from the reality of someone having to do with scoliosis, is what it does for their character and their person, and because those are things that you don't get those things from having a super comfortable life and everything handed to you, prosperity all the time. No, we get that through hardship, and so we wouldn't have asked for this by any means, but that's the reality that it can make you a better person and make you, in so many ways like that, just awesome.
Yeah.
So Thank you.
I agree.
Yeah, well, I appreciate you guys being here for the interview today.
Thank you.
Yeah, well, you just keep on keeping on. I know you will.
Yeah.
All right. Well, thanks for watching, and if you have any questions, make sure to comment, and everybody, have a great day. Bye.
Thanks for joining us today. And don't forget, you can find us on YouTube under ScoliTalk. And don't forget to subscribe so that you're notified about future episodes. You can also find us at www.scolitalk.com. Have a good one.